Hey guys, it's Dr. Sturhammer here at Penn. Hope you're doing well. Short little video here just to prepare you for your prostate needle biopsy coming up and hopefully answer some of the questions so on the day of the procedure everything just goes smoothly. So you've elected to have a prostate needle biopsy done. Maybe this is your first time, maybe you've had one done before. This is just a diagram of what your anatomy looks like. So the prostate gland is right there in the middle. It sits between the bladder and the urethra. And based on its location there, we can access it in a relatively easy and in a painless manner to have a biopsy done. After you get the biopsy done, procedure takes about 10 to 15 minutes. And what kind of things can you expect afterwards? It's a common question to ask. So typically I tell guys that you're going to have bleeding for anywhere between 3 and 4 days after the procedure. For some people, it's a little bit longer. For some people, it's a little bit shorter. You'll have blood in your urine for sure. This will last like 3 to 5 days. Blood in the semen takes a little bit longer, and then blood in the stool is variable as well. Very rare to have so much bleeding that we'd ever need to do a transfusion or anything like that. So two drops of blood in the urine will turn the whole toilet red, and this is just something that will typically just resolve on its own. In terms of pain, not a whole lot of pain associated with this procedure because the prostate itself does not really have a strong innervation, and so the nerves of the prostate you can't necessarily feel. So should not have a whole lot of pain or discomfort there afterwards. If you do, ibuprofen or Tylenol typically work just fine for resolving the pain. The thing we worry about with prostate biopsies is the risk of infection. And so the overall risk of infection is about 1 to 2%. And what we worry about is what's called prostate needle biopsy sepsis. And so that's a severe infection there afterwards of the bloodstream. That is less common, but is something that we watch out for. We will give you antibiotics to make sure that you don't get an infection, and monitor you in the recovery area for a little bit afterwards just to make sure everything's okay. The way that you would know that you would have an infection is just persistent fevers and chills, generally starting 12 to 24 hours after the procedure. If that happens, you can give our phone number a call, and then also typically present to a local ER for some IV antibiotics. Again, rare, but something that we want you to know about. Just in terms of things to expect to do the day of the surgery, lots of guys have questions about the enema. This requires a little bit of coordination because most people are driving in from some distance. So enema on average 2 hours before the procedure. So however you kind of lay that out will be up to you. So after you give yourself the enema, it takes about 15 minutes to work. And don't want you to be in a situation where you're like in the car or whatnot, and all of a sudden the enema is starting to kick in. So 2 hours before the procedure. Some people say, well, I tried the enema and not a whole lot came out. Is that okay? That's absolutely fine. That just likely means that there's not a whole lot of stool in your rectal vault, and we can accommodate that. So Fleet's enema 2 hours beforehand. And then the last set of questions that people ask, the second to last, is when did the results come back? Results come back in about 7 to 10 business days after the procedure. They will show up on your MyPenn Medicine portal the same time that they show up to your team. Whoever referred you in to get the prostate biopsy will discuss those results with you, whether it be by follow-up appointment or whatnot. So the results come to you and to us at the same time. You are welcome to look at them, or happy to walk you through them with your team, because they're written more kind of in like a physician-to-physician communication style than something for most patients to understand. Last question that people have is, what medications do I hold? You were given this pre-op packet. This was likely sent to you. And this goes through all the medications that should be held before the procedure. Because this list of medication changes somewhat frequently, I would just refer to the list for the most updated information. Typically, we want you to stop any sort of blood thinners or anticoagulation beforehand. And there are some different diabetic medications that can also be on that list as well. Other than that, we just look forward to taking care of you and thanks for choosing us.